The young children and teenagers who are suffering from rheumatic fever and rheumatic heart disease, often in distant rural areas, far away from good clinical care, are lost sight of. So we need to bring them back into the reckoning and make policymakers and health system managers much more sensitive to this problem.
So you have rheumatic heart disease, is that right?
Yeah.
Yeah.
The tragedies are that it affects kids, that we know the cause, and that we know how to get rid of it.
If we had a similar outbreak of measles or meningitis or even Ebola around the world, that would make the headlines in the news, whilst this is not something that the general public is aware.
It impacts on the most vulnerable people in our community, and the consequences of this are disastrous.
My legs started to swell and the rate of my heart was going up, like really pumping.
When I was around 10 years old, I tried to stand up to go get something, but my legs just fell.
I don't want to see other kids get rheumatic heart disease.
And how do you think Brooklyn's doing now?
She looks good, but her heart is sick.
You know, it's affecting kids, it's affecting adolescents, young adults.
So the scale is huge, and the big issue, of course, is that it becomes chronic. Once you've developed rheumatic heart disease, you are with it for life, and it shortens your life.
It is actually a disease of poverty and overcrowding.
Rheumatic heart disease appears to affect the poor.
When children have to huddle together in very close confines, in very poor living conditions, they are likely to exchange the streptococcus from their sore throat from one to another. So the germ spreads very easily.
So how many people do you end up with in this house?
10, especially that room and this room. 5 here, 5 there.
Unfortunately, in the developing countries, who happen to be 80% of the world's population, this problem continues at a high rate. In places like China, in places like India, in certain communities in Australasia, in Africa and South America, we still have this problem. The estimate is that about 3 out of every 100 children in these parts of the world are affected.
My uncle died from rheumatic heart disease, and my other uncle died from it too, and my mum.
The cost in life years, the cost to a family is big, but it's preventable. It doesn't have to be this way.
One of the strongest medicines for rheumatic fever and rheumatic heart disease is in fact social development.
Indeed, as social conditions improve, there is a beneficial effect in terms of reduced prevalence of rheumatic fever and rheumatic heart disease.
How can we ensure that this does not happen in the future? How can we ensure that everybody knows about this disease?
We're talking about the cheapest antibiotic in the world, penicillin. We're talking about a process of making sure that the normal healthcare system is equipped to care for these kids and to prevent this disease.
I think this is critical to raise awareness, both at the community level but also at a national level, to create will to put this disease in the history books.
Because I'm too young to die. Yeah.